Hey everyone, it's Josh at Prescription Fitness Physical Therapy and Sports Care in Geneva, New York. Doing another video for you. Some of our maintenance people this morning requested that we do a quick video on carpal tunnel. What is it? How do we treat it? So if we look at our hand, carpal tunnel is one of the most common entrapments of the upper extremity, followed by cubital tunnel, which is at the elbow. So carpal tunnel really occurs into this area. The carpal tunnel is actually formed naturally by the bones of the wrist. So there's four bones that kind of come across the proximal wrist, and then the top of the wrist, the roof of the carpal tunnel, is actually formed by what's called a flexor retinaculum, which spans over this joint. There's actually 10 structures that course through the carpal tunnel. The tendons, the extrinsic tendons that come from our forearm all the way down, which control our wrist motion and our finger motion. But we also have one pesky little structure, which is the median nerve. The median nerve comes in and it supplies these guys. So definitely our thumb, index finger, middle finger, and usually half of the ring finger as far as sensation. So one of the common symptoms that you'll develop is paresthesia, which is numbness and tingling, like your foot fell asleep, and you'll feel it into these guys. So if we have it into our pinky, we start to go, oh, is that, it may be carpal tunnel, but carpal tunnel with something else, because carpal tunnel typically does not affect this guy, pinky guy. So carpal tunnel symptoms, careful examination, again, clinical. The clinical pearl is that the devil's in the detail, so make sure your physical therapist really kind of screens through everything. We got to screen through our neck, shoulder, arm, all the way down to really discover, is the problem, is it a proximal entrapment, distal entrapment, or is it a proximal entrapment in our neck, or could we have what's called a double crush syndrome, which is an entrapment in the neck and in the hand, so presents a little bit different, tough to delineate. So how do we treat carpal tunnel? Carpal tunnel can be treated certainly from a surgical standpoint. They can make a small incision in the flexor retinaculum to release the pressure, which decreases the pressure on the nerve, which then decreases our hand symptoms. Conservative measures, first thing we can do is that at nighttime we tend to go in fetal positions. So as we go into fetal position, we compress the carpal tunnel. So by wearing a night splint, or what's called a cock-up splint, that holds your wrist kind of like this. It's got the metal in here. We can sleep with that on. That's going to make it a little bit better, so I can't compress the carpal tunnel at nighttime. Stretching that we can do. We certainly want to stretch the muscles on the palmar side of our forearm, so we simply can extend our arm fully out in front of us. So I'm going to extend my elbow, I'm going to pull my fingers down, and then I'm going to turn it in slightly towards midline, and I'm going to feel a stretch on the inside here. One of the key components to stretching is making sure that we stretch what are called the intrinsics, which are the muscles that begin and end in the hand. So we want to make sure that we're stretching, really we're getting our fingers to stretch and our wrists to stretch at the same time. We should hold that stretch for about 20 to 30 seconds. We're going to do that about 4 repetitions, and we can do that a couple times a day. Another stretch that we can do, and I don't have a wall to do this, but basically we put our hand out on a wall, and we try to put it flat up against the wall. What I'm going to do is I'm going to rotate it. So I'm going to rotate it so my thumb is going backwards. I'm going to rotate as far as I can. Okay, now I'm still up against the wall over here. So now I feel a little pulling going on through here. What I'm going to do is I'm now going to rotate my body in the opposite direction. So this is my right arm. I'm going to rotate slightly to the left. If I really feel that I'm actually starting to kick off my carpal tunnel symptoms. And then if I want to make that stretch even more, I kind of tilt my head we're going to go the opposite direction, so I'm going to tilt it this way. So now we've really created a stretch of the actual nerve itself from where it exits up into the neck, all the way down into our arm, into our hands and fingers. We don't want to force that. If it produces the paresthesia, I would sort of back off on that a little bit. Keys to stretching. It should never hurt when you do this. That's number one. If you're holding your breath, you're probably doing it too aggressively, so it should be light, gentle. That's a big one. So we can also stretch the muscles on the opposite side, so the extensor supinator mass on the opposite side of our forearm. So again, I'm just pulling down, my elbow's fully extended, I'm pulling down, and I'm going to rotate outward slightly. So that's going to stretch this mass, which if these muscles are tight, they're going to place extra demand on the muscles to the inside. The key to successful rehabilitation is making sure you're doing what you're supposed to do. You want to minimize or mitigate the stresses that cause Carpal tunnel is typically caused by repetitive overuse. So in physical therapists, we tend to use our hands a lot, so be pushing on stuff all day long. That creates my problems. Or if we're using the keyboard all the time or the mouse or whatever it is that we're doing, people use machinery that vibrates. That can cause our carpal tunnel. We see a lot of stuff diagnosed though as carpal tunnel, which you got to be careful because again, clinical examination is the key. Your physical therapist do the best job at this, so trust them because we have to use our clinical examination to really determine what is our algorithm for treatment versus a diagnostic. We find diagnostic EMGs and nerve conduction studies almost always. I think you go in for anything and you come out, yeah, you have carpal tunnel, but do you really? I don't know. Sometimes you do, sometimes you don't. So good examination, good history taking, good clinical examination, good practitioners, and make sure you follow what your physical therapist tells you to do, and that can help. So that's carpal tunnel. That's how we treat it. If you want to learn more, visit us at our Facebook page. Feel free to ask me any questions. PrescriptionFitnessPT.com is our website, and you can link directly to our Facebook site from there.